Yeah.
You could bring them both out, but I don't know. Your doctor say it would be okay for you to have ice on your knee? Okay. Hello.
Hi there.
How are you?
Good.
Turn over for one thing, Nancy, or turn over for one thing.
Donald Trump has assembled a wide range of supporters at the RNC, and some of the most vocal, evangelicals. Yes, he's a casino owner who has 3 different wives, but conservative Christians know him well, and he is home. He represents the God of the United States of America. So you know he's acting like a Christian. How can you build that kind of empire if you're not praying to God with things every day? A man this time in history, and God will use him. And I don't know that he's going to even be aware of this. You think he even knows what his relationship with God is? Absolutely, I think that. Stacy, I was still struggling to see how this man like the team would vote. What do you think of the idea of But then I saw a man who convinced even the most skeptical of the depths of Trump's faith. Pastor Mark Burns. That's the guy I need to talk to. The man who gave the benediction on the opening night of the RNC.
So, Michael, I pulled everything up. I think I have the volume too.
Yep, it should
Yeah.
play there.
Yeah. So,
You good to go?
I think so. I was calling you so you could speak, so I could hear.
Oh, my phone.
Yeah.
Oh, it's in there. It's in there. Recording.
Okay. So, do you want to speak when I go back?
Yeah. I can say, Emily, thank you for the coffee. Hey, Emily, thank you for the coffee. 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 Emily, can you hear me? Test 1 2 3 1 2 3. Test 1 2 3. Test 1 2 3.
Loud and clear.
Yeah. All right. So this is gonna be a pocket case.
This next to is Pacquiao, pre-op Pacquiao.
I don't know if we wrote it that way though.
Oh, on your thing? I took it from
From the previous one.
the piece.
Good.
Yeah. So
Yeah,
maybe that.
I don't remember. Yeah, we can just
I'm just
change the
gonna-
date.
I just did the
Okay, the date and the kilo.
Yeah.
And then pour Bedazzle. Bedazzle.
Took me a while to say it too. You know, not only Americans here.
Bedazzle.
Bedazzling.
Okay. Alright, well we don't need to be intubating this guy. Oh, they inflated. Ah.
Oh, they did? You want me to
Yeah,
get you? I
you
have a
have the
syringe.
tube, the syringe. Oh, Yasmin asked you, would you be able to come tomorrow at Gatesburg?
Yeah, I have to see if they gonna let me out of the center. I told her that, yeah.
Because she wanted to record it, and
Oh, so you're gonna be there?
no, she asked me if I can give you the camera
Oh, I
to
see.
take it to her. But I think she said, regardless, just leave it with you, and then she's gonna come and pick
She
it up.
lives close by.
Okay, yeah, that's what she said.
Mm-hmm.
So I'm just gonna maybe, if you're not going, then I'm gonna call her and tell her what she needs to do
Okay.
to connect to it.
Oh, I could just, oh yeah, I could chop it off or something.
Yeah, if you're not going there that morning,
Yeah, I find out end of the day whether,
whether you can go or not.
just like, you know, the room changes. I found out this
Oh
morning.
yeah. But they have 2 managers now, right?
They have
Package?
2 for pre-op and PACU, 2 for OR. So we have that.
Oh, really? 2?
So we have Chad. You don't know Chad? He'll be here at 1 o'clock. I'll introduce you. He's the one that went to Largo to train slowly. He covered there for a couple of months. Yeah. So he's been with us. Hey, Janet. Oh, you coming in? Oh, you do? Okay. No.
You want it to be quick?
No, because our lunch is ready. So you want us to bring the food here?
No, you can't
Oh.
hear.
I know, so when
This
we
is
lunch,
handsome.
that's why I'm asking.
You know, you can't eat and
But
do
Jeanette could-
CPR.
Jeanette could do everything at one time.
Hey, I'm eating.
This is how nurses roll.
I see a lot of CDU nurses here
We have a lot of CBUs that came up here in
because of the hour, right? They want to just work Monday through Friday. Where is Malik? I haven't seen Malik in a while.
Malik is afternoon.
He's afternoon.
Yeah, so he goes
He
to
was one
Falls
of the
Church in
strong
the morning.
CDU nurse.
Oh, I totally believe that.
Yeah, he's nice. I
Yeah.
really like him.
Me too. I've been asking him to come to education department because he just started master's program.
Yeah, yeah, he will be a very good. Yeah, he's very good. I like him. He's very thorough and
Even
really
he,
good guy.
I think we need more men in our team. It's like,
Outnumbered
yeah.
by large.
I always enjoy having men be my partners in the back.
Yeah, of course. It makes sense. Making everyone come. Good.
So
Yeah. Jeanette, bring it 11 o'clock. Yeah.
So everybody who's in the OR, they have the A95?
only for general cases. And then also we do emergencies, then they have to wear N95s.
But the anesthesiologists, they all wear N95.
For intubation, just the, yeah, because they do suction and stuff like that too. They should.
At this time it is.
Yeah.
I had a lot of anybody contracted COVID from the unit. One of the lady that used to sit in that office, I forgot her name. She said her whole family had COVID. What was her
Brenda?
name? Yeah.
Is there set up in conference room?
Only if there's an overflow.
Okay.
Only
I'll
for
go
overflow.
there, and if-
Uh,
and I can go back to this, and I can-
Oh, you can eat. It's set up.
It's set up.
It may just be you and me here.
They have to have people here.
So yeah, we have a whole bunch of people. Hey, are you doing this at 11?
This is the lunch and learn thing. we're doing,
It just
right?
learned today.
Oh, learn.
Yeah.
She called it. I know. I just got here, so I'm not gonna lie.
Okay.
Yeah, I'd love to.
Can't do CPR and lunch and learn.
It's too hard.
How are you?
Okay, hang it in there.
Yeah.
What's going on?
How's little Emily? Temple?
She's having a hard time with her shoes. Really horrible eczema. She's up every night, all night, itching horribly. Yeah.
And she has allergies?
Yeah, 3 of my daughters, particularly 2, really bad food allergies. Very hard.
Do you know what causes allergies? You already know? What food?
I mean, part of it's genetic, part of it's environmental exposure when young to certain things that can bring out the worst of it. Just gonna do a little learn
Yeah.
MH, I think is what we're doing, right?
MH to go. Adults.
Did you just come in? You're 11? Yeah, I came in later. I came in at 2.
Oh, cool.
Yeah.
So we're here
You can start
at
sending me?
6:30.
Yeah.
I'll have to go do sedation.
Yeah, you liking that?
So,
Yeah. You've been doing that in Angelo or no?
no, I mean, just a little. I've done it like 3 times maybe. But yeah, they just put me in PACU, so whatever. I'm not gonna argue. It's extra for me, so
Yeah.
if they want to put somebody over there else, I'm not gonna. I'm just glad for the overtime.
Absolutely. And were you there on Monday, Tuesday?
Yes. So who else is coming?
I don't know.
We got a life to save.
I think Jeanette's coming.
Yeah, they're probably gonna have a couple more, but we have a live streaming just for social distancing. We're putting it in the conference room. Cameras right there.
Oh, that's why she said go to the conference room.
Yes.
Okay,
So-
then I saw you guys here. So should I go stay here?
If you're gonna be in the
She didn't say
The
that. She told me to go to the conference room. I saw you guys here. I was like, oh.
I don't know who's gonna be participating as an active participant versus observer.
Well, I'll do it. Well, I'm about trying to train up a bit. Stuff we don't do.
I'm waiting for staff.
What's going on, man?
I
Oh
think
gosh, she's still, almost 2 nights ago. I had been with them till about like 9 and I got home at 10 o'clock. He texted me and said, okay, we just did the Lord's Prayer. She asked me to take off her oxygen. She's ready to go. We thought for sure it was going to be then. It's going to be a long, slow process. Yeah. So I thought it would be quicker, but the hospice doctor thought still a couple weeks. She's still drinking and eating little bits. So I guess the body hasn't completely shut down. It is like torture watching. Mama says, I don't know if she's gonna die of starvation or cancer.
There's 3 people that
He
have
said this is just terrible.
Hey,
That is coming. Yeah, it's just terrible watching it. You know what I mean?
Sorry, you guys went through a lot.
Yeah, it's the truth. How's your dad doing, by the way? I'm sorry I haven't asked you about him.
He's, he can't drink, but that's what happens.
He's home though. He's home now?
Yeah. I told my oldest cousin in our family, Dominic, said, I'm not going back to the hospital. So.
Yeah, you know, it's funny when they make up their mind, they're like,
I still haven't
forget it, right?
It's like, what's the use? You know, go back, I'm gonna get worse, I get weaker.
This is for
You sure?
Yeah, look at it.
Why don't you get a piece of, why don't you get a piece of tape and we'll put tape and pull it off? Here.
It's gonna work, it's too deep.
You think so? You wanna try, you ever got a credit card? I can't, you know what, Nick, I can't even see it. Ask the- Oh, our fridge freezer. Oh, I know. You know what, you need to moisturize.
I know, yeah.
Will you work at, do you wear gloves when you go and work outside?
I think, yeah, I think it's dishes, so many dishes, and then the sanitizer here.
Oh, the sanitizer, you know what one I find is so much better? The one on the wall, as opposed to that liquid one. You know the one on the wall that's
Well, I don't
foam?
do the tall one.
No.
It's smelly, it's got to
Burns.
yeah.
Oh yeah, it has so much smell.
Yeah.
And it burns like heck. Sydney, come here? Yeah, okay. So we have us three.
That's good.
Yeah, go ahead. No, I don't. Yeah, so, how are the kids?
Handful. I was up practically all night last night.
Which one?
Abrielle had a pain attack, so her legs, and so it's been there since she's been 2. Screaming, pain, so that was that. And then, of course, Emily's arm being broken out with eczema, so.
Itching and uncomfortable.
Yeah, it's
Oh,
we have to
okay.
wrap her arms and legs, just
Yeah.
like Olivia when she was a baby. She was up all night crying and yelling, waking everyone else up. And the baby was up twice or 3 times. So I never sleep. That's why I got some of this. I think, too.
Yeah, yeah.
I had a scope on the night because it's just been so bad. But then again, I'm like, what am I even doing? What am I gonna do? Do I want to take methotrexate or all this garbage? It doesn't work for me. I got so sick.
Maybe there's something else.
Anyway.
But maybe there's something else. You're not doing it with Margaret, right? Because she'll be on maternity leave.
Yeah, I mean, I got Lynn into me.
Amy Lynn.
I like Lynn.
Oh, me too.
Yeah.
Me too.
Just by observing, more comfortable with her than her. So, I'll have her do it, but then ultimately she what? Right?
Maybe there's something else that they could recommend that won't be as.
It's like situational stress, it's like exercise, like sleep. If I could get that under control, I wouldn't need any of these things that really.
Well, what can you do with the kids then? How can you
Yeah,
make things
I try
different?
to get tutors, we get advice for Tyson. She has that fever, you know, she stays with my sister-in-law who just had a stroke and her husband, they have kids.
Oh, Nick.
Yeah, so she's that's tough. That's
Oh, I'm so sorry.
trying to get it to turn just because. But we got one and I can take somebody for 10 hours, give them $20. Yeah, good.
Hi, husband. How are you doing?
5 hours.
Hey, my name is Michael. I come from the regional office to Tyson's. You're located at Tyson's, right?
You can go work out. Or
So I have a Kaiser van, and it's a fairly large van, and I parked it at the back where they have the NFS, no, not the engineering parking area. I just want to make sure that you guys don't tow the car. Yeah, there's no label to it, so. Okay, thank you, sir. Bye.
Simulation.
Who wants to what?
No, I just see jumping in.
Oh, no, I don't care. Whatever.
Okay, whichever one. Doesn't matter.
Not the sign. But Nick, when I was with CETT, do you have to pick up foundation?
Is the physician going to join or are they going to call?
He's going to he's right here.
Easing off on one day, so you can do something for yourself. Have a day where you're helping with kids, taking a nap.
Go back there
Just
if you want to.
for a couple times, just to give yourself, to not stress your see how that might help. I mean, yeah, you want to own a house, but you know what?
I'd be a distant observer.
And that's one thing you can control. That's one thing you can be like, okay, I'm not gonna do 16 hours of overtime. I'm gonna do 8. So cutting back in
Not
the
really.
8 hours. What I'm gonna do is 8 hours. I can go, hey, I'm gonna work a couple hours, send her out to go work out, then I'm gonna go work out, then I'm gonna take a nap. Much easier when you're bed. So I don't mind if you have to get up. Every else legs will settle in, and that's not gonna be every night. So that's gonna start.
She's so strung out.
Oh, you mean every illness? She's worried. She's just very sensitive.
I don't know. I mean, I don't know about that position, and I don't know if they like finance half an hour. They only see that years.
She's
Scarred. Yeah. It's like PTSD.
still.
We're waiting for that. Oh, okay. And we're still, you just tell us when. We're just still.
Yeah, it's like.
And everybody feels that. It's like, so maybe I can just really see so maybe just do that maybe a couple times just to kind of get through. This is not a workout for yourself, because it's just, you've got to have a healthy gut so you can help out your kids and help Kimberly. It's hard when you're told what you have to do. Maybe if you want to go to the side, take a 30-minute roll off and then come back and have your lunch.
And then I stopped. But I'm gonna do it today. I
You
brought
need
my
to
stuff.
sort yourself with that sun. It's gonna help. Even if you just get
20 minutes. It's all,
20
yeah.
minutes in, it's just, it clears your mind so much easier.
Right.
Even when you go home, if it's crazy at home, you say, okay, Kimberly, I'm gonna take, well, you get home late, right? You're home 9:30, 10,
No, I got
11, or you,
12,
oh,
25.
forget it. Okay, because I was gonna say, okay. What time do you have to leave, Tam? 9? So maybe you can get up at 8 and you take one of the kids out, run around a little bit, or just kind of get some pockets of peace throughout the day, because life is hard. You've got 4 kids, it's stressful enough. And then you add on issues of the skin, panic attacks, the leg.
This is me.
Really.
So get started.
Yeah.
All right.
Hello.
Hello guys, what's up? Anesthesia, blah blah blah.
Okay, so for today's simulation, we're going to be doing adult MH to code blue. And this is Michael.
Hi,
I'm Marina.
Michael. Very nice.
I'm James.
Thank you.
Nick.
Yeah.
And we have Virginia and Jay there.
All right.
Okay.
Yes.
All right, so we already took like 20 minutes from the time, so just gonna go over quickly the expectations and what we want to get out of this training. The goal of the simulation is really to how you function as a team in a critical event, and that's really key in how you manage the care. It's not really about the clinical part so much, it's really about the non-technical skills like your teamwork, how you communicate and things like that. So there is a science behind that. There's an evidence-based practice called team steps. And what team steps does is there's like 4 these big areas that they want to focus on, and we talk about it all the time, but I'm going to mention them quickly. So the first one is there a clear leader to manage the care? So that'll be your anesthesiologist running the show, making sure that things are running for the patient, right? Role clarity and so forth. The second part is being aware of what's going on around you, situational awareness. So if something is going on in the monitor, are you able to see what's happening in on the monitor and then really say it out? Hey, I think something happened to the monitor. And everybody will say, okay, rhythm change. Let's proceed with certain treatment. The next part is mutual support. So I got your back, you got my back. If you're doing CPR and the bed is too high, what do? You lower the bed for the person, right? So just give people help as they need it. And the last part is communication, and under communication, we really focus on closed loop communication and SBAR. So closed loop communication, you guys do well with medication. So if your physician order, hey, I need a milligram of epi, you come and say, milligram of epi is given with a flush and blah, blah, blah. So you guys are pretty good with that. But as things get really chaotic and a lot of order comes in, then you're gonna start to forget closing a loop of that communication. So for instance, your physician is gonna ask, hey, can you go get me the code card? And I need someone to go get me the MH card, and I need someone to call MH hotline, and I need someone to call 911. So when that happens, and roles are not really defined, hey, I want you to go do this task, then it becomes chaotic and you wouldn't know if those tasks are completed. When we talk about it like, simply, it sounds very simple, but when it's very chaotic, then you are not gonna be able to do those things. So when we run simulation, we wanna practice this as our culture, like so it can become your habit. If you've been given a task, that you close the loop regardless of the situation. So try to practice that when we do this. The other part is for a PACU setting, you have your patient, you bring them and then you talk to them, you try to wake them up, and then things start to change and you call for help. When you call for help, people that are coming in needs to know what's going on with the patient. So how do you do that? If you just talk everything that happened to the patient, they're not going to be able to help you. But for instance, the patient comes in and then you start seeing SAT going down, you call for help. What would be your first request? Your request would be, hey, I need someone to help me with the oxygenation of this patient, right? So you say, I think we need to intubate this patient. I think we need to put them on a high flow, whatever the situation is. So make sure you put out your request first, and then you can go to, oh, this is the situation. The patient was, in the OR and it just came out, and this is the background. The patient has, history of, whatever the situation, and your recommendation right after that. So these things, again, they sound very simple when we talk about it, but when you put it into context, plus, critical situation is happening, it's not easy. So, but this is why we do this. We do simulation to make sure that we kind of get into that habit. Any questions? All right. So, as far as the mannequin goes, you can, this mannequin chest rise and fall. You can feel for a pulse, carotid pulse. You can defibrillate the guy. You can pace the guy. You can, pretty much you can do most of the intervention that you have to do. Now, there's no pretending, so we want you, so if your physician asks, hey, I want you to bring the code card and connect this guy to defibrillate. We want you to connect and defibrillate. So this is your connection. It's the same connection as your pads, but you're not using the pads that sits on the code card because we want you to use this one. So again, it's the same connection, so don't forget. Come and fill the pulse before we get started. So once we start the scenario and you ask for a pulse, I'm not gonna give you that information because you can feel the pulse. Okay?
He's alive.
He's alive, yeah, indeed. Vital sign. Monitor is right there. So when we talk about monitor, putting the patient on the monitor, that would be your monitor. It's already preset for you. It runs, it gives everything. It gives you heart rate, saturation, hairline, and entitled CO2. Maybe for the setting, you may not put patients with that, right? In a PACU area, you don't put entitled CO2.
No.
Not usually.
Okay. Okay. Yeah, but you can do temperature. I'm gonna let the entitled CO2 be there, and if it triggers anything for you, then we can go that route. Okay. We're recording it so we can have other people see it in another room. Any question just for the social distance perspective?
IV access.
We do have IV access, so it's right here. So
Can we hook a bag up to it? Is that what
yeah,
or
but you can say I'm putting a bag of fluid, but we don't want you to run it.
oh,
We're gonna open it.
You don't have to open it. Yes.
Yeah, we feel
You-
right up there.
Yeah.
Pee to bed.
Yeah, exactly.
Opening. Okay.
Yeah, I mean, if we had that setting where we can have more time, then we would have done those things. But it's always, crunched. So we try to, at least to give you that teamwork dynamic, more of the clinical skills. Any questions? And then at the end of the simulation, we debrief. We talk about what went well. We celebrate our success, and then we can say, hey, you know what? Things are now working well for this way and that way, and then we can talk about opportunities. This is a very safe environment. No punitive actions after this, so make sure you and then you can speak up. Your leader is here. If you have any suggestion, make sure you speak up. Right.
One more question before we start. The difficult airway box, the orange one, and the MH cart are in the normal places they usually are?
There should be.
Okay.
That's my understanding. So if you miss them, you go there and it's not there, that's a problem.
But I just want to make sure.
Yeah,
I know where
it
they're
should
supposed
be.
to be.
Yep.
That's a good question.
So in this simulation, when we get the carts, we're gonna open
Yes.
them. We're gonna do
Except the medication.
except the med, but we can
Except
crack
the
open
med, but you can
tabs
crack
stuff.
open, you can look at, because as we open them, we learn so much that
Yes.
things are missing there. So we want you to open, but not use the medication.
Okay.
All right?
All right.
All right, let's get started. Emily will read the scenario for you.
All right, this is Tom Jones. He's 25 years old. He's healthy, 75 kilograms with no known drug allergies. He arrives in PACU after a tonsillectomy under general anesthesia. Patient has no significant prior surgical or medical history. He was pre-medicated with 4 milligrams of midazolam, PO. Vitals are 100/50. Heart rate is 110. OSTAT is 100% with a temperature of 37 degrees Celsius. Patient arrives in PACU on the stretcher, and the nurse has received report and is at the bedside.
All right, that's me. Hi, Mr. Jones. How you doing? How you feeling today? Let's sit you up. Time to wake up here. Switch out my oxygen. Here. What's wrong here? Can you breathe okay?
He's just moving.
Okay, he's just moving. I'm just gonna check my oxygen. He looks fine here. Or my tubing here. Just in case, I would like to have that ready. Alright, well I'll pretend I have a stethoscope now because I didn't assess him yet, and I'll just listen to his lungs.
Clear.
Breathing good. I like to take this off so I can see chest rise here. I'll listen to the bases.
For what?
Alright. Seems to be breathing good so far. So his heart rate's coming up a little bit. His end title's a little bit. Okay, here we go. Increasing, and I got an increased heart rate, increased end title. That could be a sign of
So temperature is
MH.
101.
I was about to check his temperature again. So 101. all right, this might be some MH symptoms. I'll call anesthesia. And hey, Maria, do you mind getting the MH card?
Yep.
And Virginia, can you get the code card just in case? Not sure. Hey, Dr.
Nick, you
Stein,
called?
this is Mr. Jones. He had a tonsillectomy. His heart rate was lower, sinus rhythm in the 70s when he came out, and the end tidal was normal. Now it's increased. How you feeling, sir?
Hello? Hey, how you doing?
Get this to the
How you
bedside.
feeling? Not really saying anything. Hey,
Not really saying much.
hey, can we get some help
What's up?
here?
Yeah, let's
Bring
put
it
the
down.
code card.
Look, you said still okay.
Move this a little bit up, and just
What was
in
our
case.
last temperature?
101.
Hey, bud.
Hey.
bit of rigid muscle rigidity.
Okay, he's feeling really tired. I'm definitely, I agree with you,
He
Nick.
has a pulse. We'll put some oxygen on him.
Let's get some oxygen. Let's get that MH card here. I agree with Nick. All right, let's crack that open. There should be a card on top. I need to.
Oh, good. Jawan's here too. Thanks, Jawan.
Perfect. Sir, how you doing? All right, do we have an IV?
This-
ID.
A bag of food
I'm
running.
gonna put up a bag of fluid.
How's his breathing so far here?
Breathing's still good. We're at 100% oxygen.
IV's hooked up.
Blood pressure, so he's just feeling really warm. Okay, can we? What's his weight, please?
75 kilos.
75 kilos. Okay. So can we get some Ranidex, please? 1 vial.
And if I may, can we get the assignment bands on and make sure everyone has clear assignment? Is that all right, Dr. Sai?
Yes.
How about I'll manage the airway since I'm, well,
I don't think we can open
I'll
them.
manage
We'll pretend to
airway. Is
open.
that okay?
Perfect.
Put this over him.
All right,
And I'm
Marina,
drawing up Ranidex. What dose
can
would
you,
you
can you
like?
drop 3.75 cc's?
Okay.
How about some cold ice packs?
So
Jawan, do you mind, or Jem, do you mind doing that?
I can do
Get
that.
some cold ice.
3.75 cc's drawn up. Would you like me to push
Can
it?
you push it and just flush it with 10
Yes.
cc's of saline?
Anything
Okay.
else you guys need?
3.75 milligrams pushed in and flushed with
Oh,
normal
you're
saline.
recording. Okay.
She's recording.
The Ranidex has been given.
Is there anything like calcium or any other medicines we need to give? Drawing labs maybe, or calling the MH line?
Alright, I'll call the MH
We
line.
have an A line, correct? Yes. Okay, so let's draw some labs here.
Okay.
Alright, MH line called already.
We'll get,
Buttons up.
Yeah, call 911 too.
Alright.
Am I saying?
Labs are drawn, being sent off.
Wonderful, thank you
Ice
so much.
packs are put under.
911 is cold as well. They're on their way.
How's he feeling in terms of, is he still rigid, Nick? What do you think?
In the groin.
Got a cold pack?
Yeah.
Yeah, we do.
Alright, so it's
Okay.
getting better.
These
Wonderful.
packs are here.
Yeah, he's got a nice strong pulse,
Alright,
consistent with his heart rate, and blood pressure is
oxygen sat's good.
good, 100/60.
Warming blanket I'm
He's
taking
okay.
off.
too. Oh, good idea. There you go.
These are cold packs, even
Okay,
though they
good.
look like heat packs.
Alright, we called, did we already call 911? Are
We
they
did.
on the way?
Dr. Sai.
Wonderful,
MH
okay.
line has already been cold as well.
Did we
Alright.
redose Ryanadex yet, Dr. Sai?
We just gave the first dose, we need to wait.
Ice packs, cool patient.
Heart rate's coming up.
I'm hanging cool saline up here. Cool
Oh,
saline.
great.
Okay.
Oh, we have to lavage.
What's the temperature again right now?
99. 99. Oh, then we have to take off. Discontinue cooling measures once it's below
Might
that.
be hyperventilating or stuff that his PTCO2 is going down and heart rate's going up, but maybe can we listen to his
Yeah,
chest here?
listen.
What do we hear out of his chest right now?
Are his lungs clear? Okay.
He's breathing.
He's breathing
15.
okay. So we don't have any airway issues. I don't want to intubate him just yet. Blood pressure is still okay. Just his
Hold
heart
on.
rate.
Oh, it looks like he's going into
He's going
deep fib
into.
here.
All right. Let's call code blue.
He does have a pulse.
Does he
He
have a
still has a pulse.
Oh,
Do you
he's
want
connected.
to start CPR?
Yes, we need to start CPR.
So I'll start
All right,
CPR.
Jim, can you just jump on?
Okay.
All right. Start compression, please. Nick, you got the airway?
3, 4, 5, 6, 7, 8, 9, 10,
All right, Marina, can you drop some epinephrine and some amiodarone and have it ready?
This stuff out. No, don't take it out. Just okay. Epi and amiodarone ready. Sorry.
Alright. Can you just administer 1 milligram of epinephrine with a flush?
1 milligram of epi given with a flush at 11:38. 1 milligram. Oh, I haven't given any. Just epi.
Alright. Still no pulse. Alright, if you're tired, just let us know, we'll switch off.
Switch.
For this one?
Okay. And when we switch, we'll check a pulse, okay?
Okay.
Alright. I still don't feel pulse. So we already gave 1 milligram of epinephrine, correct? So can we do our next medication, the amiodarone?
Okay. So I'll drop amiodarone. He's 75 kilos.
6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
I don't know that this is gonna.
Oh, this one might not have a third
Let's see.
pressure. There we go.
Yeah, but that's not gonna do it.
8, 9, 10, 11, 12, 13, 14, 15.
Let me see. I think it's 3. You know what? The amiodarone should be 3.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 13, 14, 15.
Okay, the amiodarone 150
150
milligrams.
milligrams, okay? Can you push and
Grandma
flush?
Strata.
14, 15.
150 milligrams of amiodarone given at 11:39.
Okay.
Dr. Sadi, we need to think about defibrillation.
Yes, we do. Do we have our pads?
6, 7,
Yeah.
Available? Let's get them on.
14, 15.
Yes, connected.
Alright, let's connect our pads.
4, 5, 6, 7,
Alright, still no pulse.
11, 12, 13, 14, 15.
Alright, next stop compressions, I'm just gonna check. Alright, no pulse. Alright, let's just defibrillate. Let's start at 300.
Yeah, 200.
Yeah,
It's a
200.
Bivy, so charging. Everyone clear?
Alright,
Shock.
boom.
Shock
Alright, get
given.
your on there.
Shock given at 11:40. And it
Tired,
was
you can
300
switch on, we'll
13,
swap out.
14, 15. Yeah. Next
Okay,
cycle,
next
maybe.
Okay.
Can you do CPR next, or you got some?
Yeah.
2, 3, 4, 6, 7, 8, 14, 15.
Okay.
What can I do?
Alright, looks like our heart rate has come back. Hold on. I feel a pulse. Okay. Alright. How's this oxygen set? Still in. Okay, we're good. Alright.
And he has a pulse.
He has a pulse.
Okay.
Suction.
Alright, hold on.
A little bit.
Suction
I have
a little
gloves
bit.
on.
There you go.
Alright.
Oxygen side is actually
Alright.
going up,
I'm
97%.
always here. What's going on?
Okay.
This is like your second time.
Yeah, maybe put
Wow.
oxygen back.
Where's oxygen?
What's
Alright.
happening?
Well, this,
So,
oh, you want,
Yeah,
so this,
can someone give me a report?
certainly. Alright, so this patient is post-op for tonsil surgery. Afterwards, he became very rigid and his blood temperature came up. We suspect probably militant hypothermia.
Okay.
We administered Ranadex, only 1 dose, and then afterwards he went into code into AFib, and so we just coded him.
Okay.
He just come back just now, it looks like. Can we check blood pressure real quick?
Yeah.
Okay. And the temperature, please?
90 over 50.
Temperature is 90.
Okay.
98?
So after just 1 dose of Ranadex, his temperature has come down. He doesn't feel as rigid anymore. But that's where we're at right now. We just finished
Okay.
the code.
All right, let me get the report, then we'll take it.
Thank you.
All right, good job, guys.
yay!
All right, so quickly, I know we can just quickly debrief. All right, so I'll just go around and ask everyone what went well. You can just give me one thing that went really well. So
Really? You had to go measure it?
you're right next to me, so I'm just gonna go this way.
What went well was once everybody got in one zone, everything just started moving forward.
Okay.
No looking back.
That's good.
No more.
Yeah, I think everybody's communicated really well, and I thought we told Virginia what we did when we gave it. Dr. Sy was very clear in telling us what to do. The only issue I think on my part was the amiodarone. I wasn't remembering the dose.
Yeah.
Yeah, we focus on what went well.
Yeah, I loved how Virginia stepped right in and documented. I didn't even see anyone ask her to do it. She just boom, started that. So that was good because I didn't think about that. And yeah, everyone came and did their task, came back, and the feedback loop was well done, I thought.
Yeah, I think you had the close loop communication was really great as well. Yeah, everyone was clear with their job, and Nick is awesome.
Yeah.
Yeah.
Thank you.
Yeah, when you have that flat hierarchy, then you can speak up, you can make suggestions, and you know that's where collaboration comes, right? So that's pretty good. I can see that with Nico suggested, hey, we've done epi, can we defibrillate this guy? And then let's go ahead and defibrillate. All right, that's it.
Yeah. So the team. I mean, we all work together, and we're pretty close. So we all knew what to do. We kind of fell in our roles, which felt natural in a sense, right? And no one, like I said, like you just said, no one really feels like no one can speak up, right?
Yeah.
I totally blanked on the defibrillate. Nick stepped up and 100% agreed. It's about the patient. It's not about egos and stuff, and that slipped my mind a bit. And then but like I said, our team is
mutual support.
No
And I think
hesitation.
No hesitation.
Everyone has the goal to save the patient.
I think it helped having a small group because sometimes in codes
Yes,
everybody
I
rushes
agree.
and there's
Yeah.
too many people. So
That's-
but I think most times people are like, we're good here. Let's have a couple people leave so we can just focus.
Yeah, like
More
that's a
doesn't
really
mean
good
that
point.
it's needed.
Yeah.
Yeah,
It's more chaos.
last
Yeah.
week they had an anesthesia stat, and I was pushing a dirty stretch over here, and I think Hamid called it. And by the time I got around, I already grabbed the code card. There were so many people, and I was like, all right, that's a good response. But then I thought, man, that's confusing. Like, if no one has a role, I know people want to be helpful, but go away. So I was like, I'm not going over there. Like, not to feel like, I don't want to help. But there was literally like, that's a really good idea. Because in Endo, they have like a code response team.
Yeah, that's
And then
one
only
of the
those people
discussions
go.
we've been talking about, to have a code card on the code
Dude,
card
that's a really good idea.
where everybody would be assigned a role right away, and then we'll stick to that.
Too many people cause chaos, and the energy goes up, and you can't think.
Yeah.
that probably needs to be assigned like every day in the
Exactly.
beginning. We don't know who's
Yeah,
who, and
Yes.
so
Yeah.
it's a good
Just to
idea
have
at
a
the
code
beginning.
team that
Maybe in the
needs
morning
to
and
stop
then
what
in
they're
the evening.
doing.
Yeah, morning and evening.
Exactly.
Right
I
when
think
things
that's
settle.
a really good point.
Right?
Yeah.
Rapid response team.
Right.
Yeah, they do have it at post-church.
They do,
Yeah, they do.
That's what.
Oh,
Yeah.
There was
Yeah.
on the board, on their morning
Endo.
huddle, they
Yeah.
say that you're gonna be this.
Yeah.
Yeah, that makes sense because
It's
people
much
change all the
easier
time.
Our next
with a smaller
meeting.
crowd.
Yeah. That's a good point.
What else? Anybody? Emily, do you have?
So staff from the room, they were commenting that how well you guys communicated. It was orderly, it was not chaotic, and everybody knew their parts, and there was a clear leadership between Nick and Dr. Sy, and mutual support was there as well.
Good.
Yeah, well, people are tweeting in. Yeah.
I have a question for people in the conference room or us. It's an ACLS question. When you have someone with a pulse and a good blood pressure in VTAC, do you treat them with medicines first before we go ahead and do CPR or
Well, they have a
defibrillate?
pulse,
We
so
can
you don't.
Yeah, you don't
Right.
We don't really shop
Right.
about.
So we don't shock, or we don't do CPR necessarily, and we don't. So instead, are we supposed to just give meds and
You can
and
cardio.
then try to
You can cardio.
cardiovert? Thank you. That's what I was thinking when it happened. I was like, wait, should we be doing CPR on a patient with
No,
a pulse in VTAC with a stable blood pressure? Should we try to cardiovert first? But I wasn't sure. So am I thinking right? Is that what we?
I think cardiovert and and you did say that it's a VTAC, but I feel a pulse. And
But then I was like,
and then it went into, because you want to make sure that there is some circulation, so you start on CPR. So, but
is that wrong?
I don't think so. I mean, I don't think it would be
ACLS,
wrong or.
what do you think, Dr.
Yeah, I think the
Sy?
pathway is like if they have a blood pressure, right then a pulse, then you would cardiovert it.
Yeah.
Yeah.
Maybe
After, like,
we should
review
look
the
that
gap.
up. Like, is it medicine first or cardivert first? I think it's don't wait, always cardivert
Right.
first, and then
Cardiovert
start
first.
giving meds.
Yeah.
So maybe something we could have done different is cardiovert the patient
Yes.
Right.
first.
Because we did bring the crash cart, so everything should have been there.
You could look into that, man.
Yeah.
Just like
Yeah.
I'm
You
pretty
did,
sure.
you did mention cardio. Yeah.
Pretty
So
sure.
cardiovert would have been the step to
Mhm.
to go it, but once
Yeah.
you start CPR, then rhythm would change and everything would change. So. Yeah, good point. So that's something always. Do you guys know how to cardiovert on this machine? 'Cause
Yeah,
it's a
we could
bit
try.
tricky.
We could
I
practice.
haven't tried that.
I can give
It's
you a
the
bit.
sink, right?
This one's sync?
Yeah,
Okay, so I
so
go ahead and go
it's
to
sync.
Turn it on. Let's try that. Oh yeah, there's a sync button right there.
Yeah,
Okay,
right there
but
is
the
the sink, right?
But yes, you have to press the sync.
And you start it lower joules, like
Yeah.
150
Correct.
or
Sync
something?
is lower.
Yeah.
Okay.
So you ask for how many joules?
Do
Okay.
you sync in VTAC or just SVT, unstable SVT?
You
I
know what?
think-
You're
I
right.
think you just
On
You load-
VTAC, you do from what I know, if there's a pulse and it's on VTAC, then you synchronize cardiovert.
Where's my little ACLS card?
I know.
Who knows this answer, conference room?
You need
So,
an
but-
obvious card on the cart too.
Yeah, it is. Here,
That
it's right
would
here.
help.
Where is it?
Oh, it is.
See?
See, for us in our panicking
You know
mode,
what?
we
I
didn't
know.
even realize.
Yes.
So if it my
Yes,
part-
James, that's
We
what
have
I was
learned.
like.
I know. I was like, we need to learn this stuff.
And you know how okay, here, Nick, here are the drugs right here.
Joe, you look at
SVT, then you have to give adenosine a couple times, 6, 6, 12, and then you
Oh, that's 6, 12, 6.
Synchronized,
6,
anti-arrhythmic.
Okay.
6, 6.
So what
The
I
6,
needed
6,
to
12?
do
Or
was
6, 12, 6?
17 milligrams per kilogram, and it was
Something
75
like that.
kilograms.
Yeah,
There's
that's
a 6
why,
in-
that's why we shouldn't go off of memory. Just
Yeah.
open up that thing and be like,
We should do this every month, Emily.
If we do,
17
you mean a real one or?
No, not the real one, doctor. Not the real one. We gotta
Yeah.
take this
If we
guy.
do a fake one every month,
Exactly.
it'll be fresher.
Exactly.
But we'll know where the card is. This is
Yeah.
the things like I remember there was a card.
6612.
Yeah,
6, 6, 12.
There's a dentist in
So-
Cameos.
Amiodarone.
I jumped to the other aid. Drug.
Amiodarone is 150.
There's 150. Okay.
150 milligrams, yeah, over 10 minutes.
That's the initial. Oh.
Yeah.
Yes.
I have another comment to make, but I don't know if we're still talking about
So,
cardio.
but the idea is, if you have to sync,
Yeah.
no, you always have to press sync,
Yes.
and then you charge, and then you
Shock.
shot.
Sync is
But
so you don't hit the T wave. You don't have a T wave in VTAC. That's my thought. But I could be.
I don't know. I think
Yeah,
we probably have.
You have to double
Emily
check
probably have to come up with a in service for that.
Yes.
Yeah,
So they're
and we'll just
asking,
clarify.
They're asking rhythm
cardioversion.
and
When
cardioversion
we
and
sync.
what it is when you do VTAC versus
Okay.
sync or
We don't
unsync.
get that here. I mean, like,
But the idea is the
ACLS
the
again.
system.
Once every 2 years is really enough, actually. Now you think about it.
So now you have everybody clear. So you hit shock, and then the sync is not gonna come off. So let's say after you shock, the patient went into VFib, and now you have to actually defibrillate them. You have to take off
Undo it.
sync.
oh.
So once
okay.
you sync, it stays on.
Yes,
I
once
see.
it sync, it
It
stays on.
So you have
If it's what is it? If it's a Zol or Life Pack,
life pack doesn't.
then it would automatically
Yeah.
drop off and then you have to do it again. So the lesson is when you do with Phillips, it doesn't come off, and if you go into a different rhythm that you have to shock, then you have to remember you have to
Press
take it
the
off.
sync first.
And then the other thing is sync, it's blended with the rest of the color, so it's
Mm,
I
kind of
know.
hard to tell.
Yeah.
So
Super,
again, these things when it's an emergency, then you guys would be like, okay, I don't know how to sync.
Yeah. Okay.
So that's but that was a good point. What else do you guys have that you should have been doing differently?
I could have said, I'm recording.
Yeah, that's true. Because
Yeah, we can always-
the,
Yeah.
you know, but you had a very small team, so they kind of knew with
Right.
you and a piece of paper.
Yeah, and you gave us our little
Yeah.
fans.
Yeah, that's
Our
good.
little-
We need the
But that's true, like
Do
the.
you guys know where the cold fluids are?
So those should have been cold fluids.
Mm.
So cold fluids
I think
should come.
Yeah, he
I
said,
think I did,
he
okay.
said you hang in a
Okay.
Yeah, he did say cold
It's
fluid
not
in
a
the next
port.
pack.
It's
Yeah.
not a port,
and
by
cold,
the Texas, I think.
cold
Okay.
compress.
Well, what I didn't realize was that you have to take the cold packs off
If,
when their
it's
temperature
Dropped
is
to 100.
less than 100.4. I wouldn't have
Yeah,
taken
that
them off.
actually
I
did
didn't
that
know. But according to my little thing, it
Yes.
said take them off because you don't want to cool them too quickly.
Right.
Okay.
Yeah. So that's why having that card
Yes.
helps you to communicate better.
Very much so.
If
Cold IV
you're
fluids.
a reporter for a malignant hypothermia, use this sheet
Ah,
as a
okay.
guide.
So that's the shit.
Because you guys picked up actually,
Yeah, I saw
you
the.
guys picked up and then you start doing it, but if you stick to it, it
Oh.
kind of helps.
Mm.
Got it. So it kind of tells you. Okay.
It kind of tells you what you need to do and
Oh, the hotline.
Yeah.
Good, that's
Yes.
in that sheet.
Yeah.
yeah.
But
That's
it-
in the
But he
clipboard on
recovered
the-
really quick. That's
That's
why
true.
I think we
Yeah,
get to
because
have
you guys
that
were
stuff.
really getting into it, and then you know, you guys started mixing the ranitics, and
Uh-huh.
that's part of the kind of the triggering point. Hey, are you using the medication quickly?
Yeah, and when I mixed it, I just said I drew it up.
Yeah, you
Flush
mix it
afterwards,
with
but I didn't.
a
I know.
5 ml of
Saline.
sterile water.
Oh, okay.
And,
so I didn't say that. Mhm.
I didn't say it. I just said the dose and.
Yeah.
2.5 milligram per kg. But you guys have the chart here.
Yeah, you
So
told me to do
75 kilo would be 3.75 ml.
Yeah.
So you don't have to do
It's a lot easier to drop than the natural.
yeah, it's I know.
Yes.
The dantrolene was like a lot of mixing.
Yeah, and then you have to say mix it with this much and
But
then.
can I see a vial of it? Because I just
Yeah.
like was pretending I was
Right,
drawing
that
it
paper
up.
box.
But I wonder,
So
I wonder, so 3.75 milliliters, is that easy to drop, like when you're given that? Like what's the dosage on that?
there you
Because you'd be
go.
fumbling,
Vial.
is how much?
So this is.
That's
I see. Okay.
2.5.
Ranitix is powder like that.
Okay, so I had to
That's
mix
why.
that, like how many milligrams are in there? Or I need
250.
250 per vial.
250 per vial, so I draw the whole thing up, it only gives 37.5
So
milliliters?
5 cc's into a vial and then give 3.75. I think that's the way this looks.
No, it's on the.
Oh, right in here, right
Okay.
here. Oh, okay.
Oh,
So you drop the 5 cc's of this, put it in here, and then just drop 3.75 milliliters of this.
Just mix it and then you roll it out.
Got it.
3.75.
The chart gives you exactly
Yes,
the
okay.
cc dose, which is the easiest way to get it.
Yes, yes, agreed. Okay, okay. Did you know that? So you put the 5
never
milliliters
used
in
Ranitix,
there, and then you
so.
drop how many milliliters you need according to your kilograms, yeah. Okay. Yeah.
Tell you the-
You push this fast too,
Yeah,
right?
you went to food.
Yeah, yeah, okay,
Yeah, if it was, the reason we combined it
Yeah.
is because this is a COVID time and
Sure.
everything
Yeah.
all separate, so,
yeah,
so that's why at least let's get it done for.
wow, yeah, that's good. And the cooling fluids, where did you say they were? I'm sorry.
Emily, where are the cooling fluids? So you have a 3,000 cc, for the lavage, and then you have your cooling fluids all at the anesthesia room, right?
No, sterile wards, anesthesia rooms.
So you guys need to know.
Yes.
Yeah.
you know,
I
Essential.
would, yeah.
The sterile wards.
And then you guys can go in with your clothes if something.
Yeah, we can go look for it.
Yep. You don't have to wait for someone who's sterile to go there.
If it's an emergency.
If it's an
No,
emergency,
it's not.
just
Okay.
try and get it.
I mean, worst case, room temperature fluid is pretty cold.
Yep.
Yeah,
Better than
Yeah,
that.
but if it's an emergency, you're allowed to go in.
now the lavaging, I know they mentioned, stomach lavage on here.
Well, that's something to put out
Yeah,
about the QA.
yeah, on the cooling thing, the little, thing that I have, and that's what I had a question about. Yeah, also you put in NGT, number 3 and after, and after all that.
And they should be all all the supply should be down there.
So you put the NPs in, you take the catheter in, and that's how
I don't know where they.
the irrigation tray is right here. So there's the Foley.